Welcome to the Poisoning Podcast. I'm your host, Erin DeLullo. Please like, share, and rate this episode. Today's guest is David Ovalle, a national reporter at the Washington Post covering addiction and opioids. Previously, he worked at the Miami Herald, where he covered crime, hurricanes, and justice. Today, we're going to talk about his article. I'm going to read it to you. Didn't memorize the title. Drug deaths are down in one Ohio county and much of the U.S. Why? Welcome to the show, David. So I didn't get to say hi, but I was at the Brookings Institute Fentanyl Symposium that you moderated a panel at, and I've actually really enjoyed that. But will you start telling our listeners a little bit about the piece you did in Hamilton, focusing on Hamilton County, Ohio?
Sure. I work for the health and science team for the Washington Post, and we've done some stories have a lot of national publications about the sharp decline in overdose deaths. And the one thing that I wanted to do, kind of spinning it forward, was kind of look at just how one community why the deaths have gone down in one community, what they've been doing in one community, and sort of how that translates into the bigger picture. So I chose Hamilton County because they've been really progressive in terms of, I say progressive, they've been really proactive about public health policies, trying to do as many different things as possible, flooding the neighborhoods with Narcan, really pushing or beefing up addiction treatment and different programs. But also, they sort of have a lot of government roles, and they also have a lot of grassroots roles. And because Hamilton County is a place where the deaths have just went through the roof, and earlier than in some places, but this was sort of one of the epicenters of the opioid crisis, because it started out with this is now, for anyone that's not familiar with Hamilton County, it's basically Cincinnati, but it's right on the border of Kentucky, northern Kentucky. So you had just a flood of prescription pain pills that were permeating the county and the surrounding regions, like in the 2000s, and then that, like in many places, turned into heroin, which later turned into, of course, fentanyl, so the deaths really went through the roof. And what you're seeing in terms of trends in a place like Hamilton County is what you're seeing in a lot of places in the United States. So I thought it was sort of a valuable lens through which to see the trends that are out there, and what are some of the encouraging signs, and what are some of the still uncertain signs, and what are some of the things that are still really concerning in terms of just the sheer amount of heartbreak and deaths and carnage that we're seeing with the drug crisis.
I mean, just your opening paragraph, which I will make sure to share the article in our show notes and in the Substack this weekend. But the death, right? So many people, I think, in this policy realm are so far removed from how families have been affected in this crisis. I don't like to call it a epidemic anymore because I still think we're not really going down. We have so much death. I'm glad that overdose deaths are stopping, but people are still using.
Yeah, and the point I've made in a lot of these stories that I've done on the recent rate of deaths, the deaths dropping, is that even if we're getting under 100,000 drug deaths per year in this country, just a couple short years ago, that would have been an unimaginable number of preventable deaths in this country. I mean, I remember looking back at stories when the country hit like 60,000 drug deaths, and that was like a huge deal. And if that was the case now, we would be, dancing on the rooftops because it got so high. So it's, I think, I don't want to say that sometimes we're numb to the scale of the tragedies, but the fact that we're still okay, we're under 100,000, maybe we'll be at 80,000 for 2024. It depends. It could get down, give or take some thousands, but that's still a lot of people. I mean, the way I put it in my article is, basically, you know, one of the models that I ended up citing was, they're still predicting, 50,000 opioid deaths per year by 2030. Like, that's more people than we lost in the Vietnam War for the entirety of the war. So it's a staggering amount of people.
Yeah.
And I think we need to be cautious about getting numb to those high numbers.
I, Excellent point. And I think some people are numb. Now, I live in West Virginia. I don't know if I mentioned that to you. So we have a lot of issues here still in the crisis. Listeners will hear me say this all the time. Was it in 2023 we had 1 in 8 babies born addicted. We have the most violence happening in our public schools are coming from kindergarteners who are being raised by people with drug use problems. We as a society here in this state are just, it has so much effect. And there's a lot of talk currently on the supply side of drugs. But why I liked hearing what Hamilton County was doing is because we need to really also be addressing the demand side as well. And are you, in your reporting, are you showing that having the effect in the overdose death decline?
It, there's, it's hard to pin down one particular reason. I think most experts believe it's a confluence of things. Certainly having the public health uh, pathways as a priority is really an important thing. And I think, I mean, even now, looking in 2025, the idea of having Narcan out there and handing it out sort of freely, just maybe 10 years ago, for a lot of communities that would have been, crazy, right? But now I
Yeah.
think even in more conservative states, it's not a bad thing because people realize that this is helping keep people alive. Um, but I think there's a lot of complex reasons why the deaths are dropping, and frankly, I think it varies from state to state. Drug markets are so um, diverse, right? The
Right.
drug market in Los Angeles or Portland, Oregon is going to be completely different than it is in, Morgantown, West Virginia, or, in South Florida, or, New York City, even. So I think there's a lot of nuance to why these numbers are coming down. And I think it's very easy to kind of just proclaim, like, and I think the tendency is to want to boil it down to talking points, particularly when it comes to the political aspects of it. We can raise our fists and say, we crack down on cartel members, therefore, we're stopping the crisis, or we're pushing harm reduction, so therefore, you know, everything's solved. And I think that is makes it sounds for easy, social media posts or talking points, but really I think it's a combination of a lot of different things, all of those things included.
Yeah. And we may actually really never know, right? Like the actual reason, like what specifically is causing the decline. Is it naloxone? Is it a difference in the drugs that the cartels are putting out?
Yeah, and I think it could be most likely a lot of those things. I mean, one of the more grim theories that some epidemiologists are subscribing to is that basically it's burned out it's sort of burned through the population, the at-risk population that it's going to, right? There's not as
Yeah.
many new opioid users um, to replace the ones who have already died. So there's a lot of debate within the research community about this theory, but I think a lot of people give it at least some credence that, there's just not as many people um, becoming addicted, right? So as there was, 15 years ago when prescription pain pills were, getting people hooked. And then suddenly when those became harder to get, you turn to street drugs, right? So certainly the stress of the pandemic and the
Yeah.
different dynamics of the pandemic added a whole level of complexity to it. We can talk about that, but that's also sort of one of these wrinkles that we have to kind of wait and see, just how much of a blip that was, or how much of a spike that caused. So, are we just kind of getting back down to the trajectory that was already going on? Was that just a sort of blip, a spike, or is this just a wobble? Are we going to keep going back up? There's so many different, um, you know, estimates and reasons why it could go either way.
And it's going to take a while because a lot of this data is piecemeal, right? You're getting it from researchers are getting it from local and state reporting.
Right. So one of the things that is maddening about the way our system is set up, but it kind of makes sense given that we are such a large country, right?
Mm-hmm.
And so fatal overdoses are tracked at the county level and then reported to the states, and then those numbers get reported to the CDC. Now remember, drug deaths are they might take 4 or 5 months to get finalized because you have to wait for the toxicology reports to get back. Some states have more capacity to do, or some counties may have more capacity to do drug testing. If they don't know what the drug is right away, like in the beginning, a lot of drug toxicology labs weren't set up to test for fentanyl, right? And then if you have these sort of fentanyl analogs or other nitazines or
Yeah.
other sort of novel drugs that are popping up in our drug supply, that might take longer. So sometimes, I mean, there's a reason why the data from the CDC, even the provisional data, which is just estimates, won't come out until for 2024 won't come out until roughly like April-ish, because the states lag in reporting it because there's just so many moving parts to try to get that data out there. So yeah, that's one of the reasons why, sometimes you have to kind of step back and look at these things historically, because
Mm-hmm.
tracking it in real time can be, more than a little bit challenging.
Would you go into some of these new drugs? You mentioned the I can't even say it right. Isn't this awful? The is it nizidazines? Did I just say that right?
Yeah,
Nitazine.
nitazines.
Sorry.
Yeah, if you so I did a story about a year ago about the growing rise of nitazines,
Yeah.
and I think it's just emblematic of the fact that we have our drug supply has become more synthetic and more diffuse, right? I was just talking
Yeah.
with someone about this today where, I don't know, 20 years ago, you relatively kind of knew what your drug supply contained, right? You had your heroin, you had your cocaine, you had your marijuana. It was, of course it differed from region to region, but generally you kind of knew the potency and sort of what it entailed. But now because of the rise of you know, you know, do at-home chemists and
Yeah.
people adding things, and the rise of synthetic drugs and the ease in which you can make these drugs, whether it's with precursors from China, whether you're in a lab in a clandestine synthesizing lab in Mexico or Canada even, and then certainly mixing and matching, adding different adulterants to the drug supply to stretch it out. Um, it's so complicated and nuanced and mostly unpredictable that people, a drug like nitazines, which come from China, you can, in the story that I did, you can see that they actually, I chronicle sort of the first case in which the feds charged a Chinese company for selling nitazines. And nitazines are just different types of non-fentanyl opioids that can be many, many times more dangerous. And if you don't have the tolerance or you have no idea what you're using, it'll kill you. So, there can still be reversed with Narcan, but if you don't know you're using it, you don't know it's that powerful, you can certainly succumb to it. So there's always alerts going out. There's always flare-ups with this drug. There's, certainly you've heard of drugs like xylazine, which
Yeah.
are added to the fentanyl, and other things that get added that just sort of complicate everything. And so sometimes you have these substances that people just have no idea what they're using.
Yeah. No, I that's why we call this show The Poisoning. I think people there are people who are addicts and have addiction issues and are seeking out these drugs, but then there's someone who thinks they're taking a Percocet, an Adderall, and lo and behold, it's not what they thought it was.
Yeah. And then you also have sort of the complexities of you might have someone that's been in treatment and
Yes.
has been clean for a while, and they think that maybe whatever they go back to using was similar to what they used before, but it turns out it's a lot stronger, and they have no idea what they're actually getting. And so I did a story when I did my story about nitazines. I chronicled this woman who died here in Miami. She was from North Carolina, and she had been on methadone and
Uh,
off heroin for a long time. And then, she thought she was going to go take meth, and it turned out it was mixed in with nitazines, and it killed her. So, you
mm.
have this sort of real, just deadly concoctions of drugs that a lot of people just don't realize they're taking.
I mean, I think it's flowing into the marijuana space, right? Where people, even if it's not a nitazene mixed in with marijuana, the strength of the marijuana these days is very different. People, I believe, just assume everything's been the same for decades, and that's not the
Yeah,
case.
the marijuana is interesting because I think there's a lot of claims by law enforcement and some politicians that fentanyl is getting mixed into marijuana. I don't think it's not as that's not as clear cut as maybe some sound bites would have you
Sure.
believe. It's not really, those two aren't really mixing. But what you're completely right about is that the strength of marijuana is completely night and day different than it was um years ago. And I think that has, there's, of course, because it's legal in so many places in so many states, and it's not just the sort of leaf plant substances. It's all the different edibles, and the different oils and the different those products that can be up to like 90% delta 9 THC, right? And so that suddenly, if you're a kid and you're picking, you're vaping this, and suddenly you're not used to it, it can cause like real bad problems, right? We did a story about that. Done a couple stories on marijuana addiction, but it adds just another level of complexity to the drug use space out there. And that's not even considering the hemp derived products, which are a whole nother
Oh,
um,
yeah.
ball game that is equally as unpredictable.
Ball game and industry. There's
Yeah,
money to be made.
yeah,
I'm a big fan of naloxone, but here in West Virginia, it's not easy to find in my county. And then I've dealt with so many policymakers, they've never even held it. They don't carry it on them. And I'm glad to see that it's being flooded in a county like Hamilton. But I will tell you, in my county, the average person could not find it easily. So that's concerning to me. I think there's, areas where it's very readily available and given out easily. And then, is the average person in West Virginia going to go to their CVS and find out that it's $77 a box? And if they have it, pay that $77? I don't think so. Um, and I find it very important because in your story, it takes sometimes with these drugs several doses, right? So it's several sprays, which there's only one spray in a 4 milligram naloxone. to be revived. So are you seeing it in you say it's, you saw it a lot in Hamilton, but are you seeing that other places that you're visiting in the United States?
Yeah, it's again, it does vary from state to state, right? West Virginia has its issues. They have more sort of despite it being one of the epicenters of the opioid crisis, they have more restrictions on programs like syringe services, other programs that are geared toward keeping people alive from the detriments of drugs. Um, States like Alabama make it harder. And it really kind of just depends on the strong network of people. I mean, I've spoken with harm reduction folks in some of the western states, Wyoming,
Mm,
Montana, where it's just like it's impossible to get it out there so freely. Um, and one of the interesting things that I'm sure you've probably talked about this is that you know Narcan itself um, is over the counter, but I think that
right.
that could be maybe not misleading, but maybe it's not as prevalent as you might think because it is so expensive. I mean, even just your average like suburban mom isn't going to go spend $45 on a Narcan at Walgreens, let alone if you're someone who's struggling with substance use, right? So
Mm-hmm.
meanwhile, the generic liquid naloxone is just a couple bucks a vial, right?
Right.
Um, but that has to be injected with a needle. So there's a lot of like trepidation about that. There's a lot of states that aren't so comfortable with that being out there. So that's not over the counter yet, right? It's only the spray version. There's a couple of different spray versions that are out there now. So I think there's still a lot to do in that space. And again, it's going to be from state to state, community to community, where it's going to be a little bit different.
Could you touch on a few of those states you just mentioned and what their barriers? Because I think naloxone is becoming just more accepted. It's seen differently from, say, an overdose center or a needle exchange. I think it is seen when, I mean, I talk about it probably every day of my life with even someone who's never thought of or even knew what naloxone was. They've only heard of the brand name Narcan. So, like, what are the barriers in Alabama? Why is it maybe a little more difficult to get it there?
There's more restrictions on some of these things. At least there were before it became over the counter. Now that's sort of
Okay.
loosened up more. So I think at this point, a lot of the barriers are going to end up being um, like resource driven, right?
Mm,
And so like if you naloxone itself, there's standing orders, so you could still get it but through the pharmacy or they've made it easier to hand out. Alabama, I think, had some more restrictions last time I looked. Um, but I think it's gonna come down to, are there enough people out there that are getting it out into the community? Are there funds for it to get out there? There's a lot of different I forget which states, but in some states there's
hmm.
you can't do it as easily by mail. Only certain groups can distribute it. One of the
Wow.
things that I thought was kind of cool in Hamilton was that the county has a really robust partnerships with the different groups and nonprofits, but there's also other harm reduction groups that get the Narcan from the health department, and then they just kind of distribute it to informal distributors on the streets, right? So there's like a formal and informal network, and there's a lot of sort of underground distribution networks, but they just often don't have the same access to the amount of Narcan, the amount of naloxone, and other things that help keep people alive, test strips, things like that. Um,
Sure.
so so it really, I think a lot of it's going to be resource dependent. Um, naloxone itself, I mean, I'm sorry, Narcan itself is expensive, right? So even at
Mm-hmm.
the reduced rate for public good, a
Interest.
lot
Mm-hmm.
of like like your harm reduction groups that work in rural areas are not going to be able to afford it, right? So sometimes it may flow more freely in urban areas, but
Yeah.
in rural areas, it's a little bit harder getting it to people because you're farther away from city centers. It's not as easy to pick up. That's a little more challenging. So it's going to vary a lot by region to region. But I think the resource aspect of it, the price point aspect of it is going to be still a challenge.
Yes. And that's why, so the group I work with, Harbor Path, we provide it for people because I don't think they're going to get it any other way. There are very few people so determined to go, have access to it. Honestly, I thought they should have given everyone a box of naloxone at the Brookings symposium. I'm gonna like actually put that. If they had a suggestion box, I should have said that. But I carry it on me. There's you just never know when you can save someone's life. So do you keep naloxone?
Actually do. I have some Narcan that I keep, and I've actually given it to my wife as well. So she carries one in case, we have a toddler, and you never know. I mean, I know it's a pretty the odds of something like that happening are pretty low, but it never hurts to have something on you if, your kid picks up something and it turns out to be something, something bad, or you're witnessing somebody have an overdose,
Yes.
and in the middle of wherever, you never know when it's going to come in handy. So I don't think it hurts to have it, but I think just raising awareness about it is certainly
Mm-hmm.
important.
Couldn't agree more. So, would you like to get into a little bit of this new administration's health policy, or at least what we're seeing from them? Do you have any predictions?
um I you know I think I don't know who's going to be the head of ONDCP. i
Okay.
don't know I don't know how differently the administration will approach the public health aspect of this crisis. I mean, certainly there were a lot of strides that were made during the Trump 1.0, but with this administration, you never know because whatever the Biden administration did, the Trump folks just want to go the other way simply because the because of what the previous administration did. So I'm curious to see how the messaging is conveyed in terms of harm reduction, right? The Biden folks made a big deal about this being the first administration that embraced the aspects of harm reduction, right? And in many parts of the country, the harm reduction as a concept is still pretty controversial, even though it can vary from in degrees of, like, I mean, some people might see harm reduction as being like just allowing drugs wholesale use and letting people do whatever they want. I think it's probably a lot more nuanced that depending on the community. But certainly, I'd be curious to see um, if they are going to embrace the messaging of harm reduction. And that being said, I mean, just the federal, I mean, all the grants that you see are in peril right now. I'm curious to see, and that was certainly something we spoke with folks in Hamilton about. Is they're worried that some of that federal funding might dry up, and there might not be
Mm,
money for naloxone or fentanyl test strips or any of the other federal money that's gone toward bolstering rehab and syringe services and things like that. So I think there's going to be a lot of tension points. Um, I've spoken with people with the transition that have said, like, they're going to still focus on public health.
good.
But things are so unpredictable with this new administration that it's going to take a little bit to figure out how it's going to go.
Yeah. No, I think it's going to be a wait and see. He's obviously trying to work on the supply side, but as I mentioned early on, the demand side and harm reduction. And I feel that there's different levels of harm reduction, and some people think of it all as one thing, as you said, like maybe it's just the Tenderloin in San Francisco and everyone's, allowed to, well, they're not allowed, but there's a lot of open drug use that affects the community. where, and I think the people would think that that's going to come to their small town or community, whereas harm reduction could just be as simple as carrying the Narcan, um, and being able to save someone's life. But it's very, it's got a range, right? And I think there's also some politicalness to the phrase harm reduction, like that
Yeah,
hurts it.
I think what what happens too is a lot of it has, especially in the election year, got wrapped up in the sort of law and order politics, right? And you know, it is very easy to focus on the sort of open drug use, the visual and visceral nature of what we see in communities like the Tenderloin or in parts of Portland, Oregon, or in areas like Kensington and
Yes.
Philadelphia, which it's like it's very easy to just think like, oh, that's going to happen in the streets of every city. This sort of the sort of fear mongering headlines that you see on cable news. But what I think is lost in the discussion is that most drug deaths are happening behind closed doors. They're involved
Yeah.
with people that are, many of them have jobs. They're people that are struggling with substance use disorders, and they're not homeless, or they're not on the streets, or they're not, destitute and, you know, passed out on a sidewalk somewhere in Kensington, right? So that's one of the things that I think gets lost on a lot of the sort of political rhetoric that we see around this, is that you know people don't want to see those things in their neighborhood. They don't want to see drug use in their neighborhood. They don't want to see needles and stuff on their streets, and that's understandable. But I think harm reduction goes beyond just what you see on the streets. It goes to,
Yes.
the 16-year-old who is trying Percocet pills, in his bedroom, or the medical student who's, trying to keep up with their class load and are, addicted to stimulants, right? So it's a lot broader than just sort of what we see in those visceral social media images or on TV. Um, I'd encourage you to check out a story we did, me and Alana Gordon, we did on technologies that are being uh, experimented with to keep people alive. Things like never use alone hotlines, different apps and wearables,
Sure.
different motion sensors that are aimed at getting people who are using behind closed doors to not use alone. I think that's one of the main things that I think is we don't stress enough, is that people who use alone are going to be at much more risk, and so there's a lot of push to try to get people to make sure that if they do use, that they're using with someone on the phone, or they're using with a friend, or they're using with some sort of supervision, that is not in an overdose prevention center. It's at home. It's a simpler way, that is a lot less controversial.
Now, I think this was discussed during your panel at Brookings. Keith might have brought this up, the billboard. This reminds me a little bit of the billboard in San Francisco where it was saying, don't use alone. And I think that may have caused some controversy, right? Do you remember
Yeah,
this?
yeah. I think the billboard he was talking about it wasn't about using alone.
Okay.
I think it had to do with like don't let people
It's like
like I
fentanyl with
think
friends. I
yeah,
don't know.
fentanyl. Yeah, but it
You
was
did
in the
that.
way it was like it looked like a beer commercial where it was
Right.
like
It
young
wasn't serious.
professionals.
It was like
Yeah, like
everybody was having at their barbecue or something. And
right, right. And that is where I think you get some of the pushback, is that um some in the harm reduction community, um and I don't think this is the entire harm reduction community. There's
Mm-mm.
always these tension points within the harm
Sure.
reduction community, but certainly people don't want to see. Um, People are very wary of sort of like just let people use whatever they want, and it's a free for all and no judgment and that kind of thing. And I think you've seen that. I mean, I think there was even some ads that were posted a couple years ago where it was like F rehab, and that kind of thing. And so these things, it's very controversial. And if you've ever dealt with anyone in your family that's dealing with substance use, certainly you don't, you want to see what's best for them and for them to get off drugs. So I think there's this tension point, and I think it's sort of like a pendulum. And I don't, I think, um, that the experiment with Portland in decriminalizing the possession of certain drugs, I think was a learning lesson for a lot of that sort of leftward um, uh, approach that many were championing a couple years ago. And I think it's sort of now might be swinging the other way. And so I think there's probably a middle ground that is probably the best course, but it kind of, we're at a inflection point in the country, not just in public health, but in crime and drugs and politics and everything else. So it's a little unclear as to where it's going to go from here, but it's going to be important to watch.
My thought on the billboard that says like F rehab, I'm like, no, rehab needs to be longer. Recovery options should be better. You know, I think that I didn't know about the F rehab billboard. Oh my. I mean,
That was a couple years ago, and it was one of these
sure.
things that was supposed to be like provocative, but I think it ended up sending a wrong message. Google it, you'll see, because I remember this was sort of a
It,
lightning rod of and it kind of encapsulated sort of that some of those tension points between um the different varying degrees of harm reduction.
yeah, I will. I definitely will. I think, and I do. I think we should have better access to recovery, and it shouldn't be 21 days. It should be longer, and our goal should be not to have, as a society, citizens who aren't addicted to drugs so they can be great members of society and great family members and have and great friends, and sadly this addiction really breaks down that, as you see in your story. I mean, who was it? It was Evelyn. Like, she lost so many family members. And then I think of the younger, like the nephews or the nieces. Well, what they see their caretakers doing is drugs, right? And as a child, you just learn and you think that's okay. It's a learned behavior. And not everyone, but it will sink in. And we just have to learn to correct it and give people chances.
Struck by the intergenerational trauma, these patterns that exist. And I can't tell you how many times I've interviewed a mother who's um, dealt with drug abuse, and then her son is dealing with drug abuse, and then her grandson's dealing with drug abuse. And it becomes these long-standing patterns that you hope will get broken. And I think the stigma is still there, of course, but I think it's getting better. Um, but certainly because it's touching so many people's lives. But certainly, I mean, I think, you know, we're a long ways to go. There's still a long ways to go in terms of, sort of how we view addiction, and sort of that constant tension between moral failing and, it's a disease, and sort of all these thorny questions
Hmm.
that we as a society are still grappling with.
We are grappling with it. The phrase you said, intergenerational trauma, we are seeing that here in West Virginia. It's in Ohio. I'm sure it's in all of these communities because this has been a quarter of a century of this drug use. Yeah, I can imagine. Well, I hope you find a way to relax that isn't, a drug. But it's hard. It's hard to like. I interview people too who lose family members, children. One of the aspects of this crisis, and I met a lady who's involved with a nonprofit. There are so many parents who couldn't afford to bury their children. So they set up a foundation to help with burial costs, for people. And it just, I don't think as a society we're thinking of it like that. I think we're thinking, oh, we shut down our borders, all the supply will be gone, and then all the people who just do it for hedonistic pleasure, that will be cured. And it's not that. I wish it was that simple. It's not that simple.
Yeah, it's never that simple. And I think you see this, it starts with the GoFundMe page to try to, help out, for funeral costs. But it goes beyond just the deaths. I mean, now you have
Yeah.
grandparent like Evelyn in my story. This didn't make the final story, but she's
Mm,
caring for three of her grandchildren, right?
right.
Those
Oh,
grandchildren have special needs and have their own issues. And so it's like grandparents suddenly becoming parents again. And there's just so many strains financially, socially, and so some of these kids are just going to grow up not in the best situations because their resources are just stretched thin because they've lost one or both of their parents to drugs.
and that, yes, that is a huge part of this crisis. So thank you for covering it. Is there anything else, since we'll probably be coming up on time, anything else we should be following that you're working on, David?
Uh, yeah, I mean, just the politics, I think, is going to be very interesting to see how the messaging goes. If there is a turn more toward the punitive versus the public health, what is the balance that gets struck?
Mm,
Um, and whether the funding will dry up. I think that's going to be really interesting because so much money is funneled from the feds to the states and then out onto the streets in terms of grants for naloxone, grants for harm reduction groups, and certainly you're seeing um, a lot of that funding is being reviewed and questioned by the incoming administration or the new administration. So I think everyone's sort of like in a wait and see mode.
yeah. Well, that's exactly right. Where can people follow you, David?
I'm on X, Twitter. Not as much on there as it used to be, but certainly I'm on Blue Sky as well. But really, just WashingtonPost.com. You can go to the health and science page, and I'll be on leave for a couple months.
Oh,
Got a new baby, um, so I'll be back in the spring. But certainly, if you want to catch up on all the stories that I've done recently, there's all on one page there.
there.
So I appreciate the follow.
Well, congratulations on the new Bambino or
Thank
Bambina.
you.
So that's great. Well, thank you for joining the poisoning, David.
Thank you. Appreciate it, and happy to speak about this stuff at any time.